This is CGTN, China Global Television Network.
Tunisian authorities have warned that increasing amounts of medical waste generated due to the COVID-19 pandemic now pose a serious threat to public health. As a result, waste management agencies have issued guidelines to be followed when handling the waste. CGTN's Adnan Shawashi got exclusive access to a medical waste handling facility and filed the following report.
Across Tunisia, there are 43 state-sponsored quarantine centers, as well as dozens of hospitals and several referral laboratories. Garbage contaminated with bodily fluids or other infectious materials is becoming a serious concern for public health facilities as they brace for a surge in the number of quarantined individuals and COVID-19 patients.
The national strategy put in place to fight the coronavirus pandemic and stop the infections is multidimensional and multi-axis. The main danger is the management of tons of contaminated waste at health facilities. The strategy was enacted as early as February.
In addition to thousands of frontline healthcare workers fighting COVID-19, National Waste Management Agency and National Environmental Protection Agency workers are also tackling the virus.
The National Environmental Protection Agency sends control missions to healthcare facilities, hospitals, recycling units and quarantine centers in order to make sure that safety measures are respected. This high-risk operation requires a considerable effort to guarantee the safety of all stakeholders.
Medical Waste Solutions is one of the private partners of the state. The company is in charge of transporting, disinfecting and decontaminating tons of garbage. The process is extremely complicated, but people here have been trained to deal with hazardous waste in a professional manner.
Treating hazardous medical waste is a complicated operation. The garbage is first transported carefully to this recycling factory, then disinfected with water vapor at 121 degrees Celsius for 30 minutes. COVID-19 and quarantine waste is treated twice to make sure the virus is neutralized.
Despite efforts by the Tunisian government to ensure proper handling of medical waste, it has become usual to see discarded face masks in the streets or in the wild. Environmentalists have raised concern about this alarming problem. Medical supplies and disposable personal protective equipment like face masks and protective gear pile up as medical waste that needs to be safely discarded. The Ministry of Environment and the Ministry of Health have put in place a strict sanitary protocol to guarantee the safety of their personnel. Adnan Shawashi, CGTN, Tunis.